Okay.
Hello, my name is Joel Rosen from drjoelrosen.com, and today we're in my office to demonstrate a stretching routine that you can do for your lower back. Many patients I ask in my office if they do their own stretching routine, and some say yes, some say no, and I always try to get an idea as to what they do, and I'm amazed as to the exercises or stretches that they're doing that can actually be hurting their back. You don't need a lot of space. We're here in my rehab area where I actually took this matting from home, and it's a nice soft little area that you can do a good little stretching routine. Or if you follow me, we can do a little stretching routine in your office, and you just need basically a little mat to be able to do some of the stretches. I suffer with back pain myself, and this is a little routine that I designed around the mechanics of what goes wrong in your lower back. I have here a model just to describe a little bit. In my case, I have a disc herniation at L5S1 that goes straight backwards. Disc herniation kind of looks like this, although it probably wouldn't be that big, and it's more towards the back. So the first thing we want to try to do with a stretching routine is we want to try to address the structural component of the spine, in this case the lower back. Next, what we want to also try to do is work on the hip flexors, because that creates a lot of pain in our back as well. People who sit down for long periods of time tend to have a lot of tightness in their hip flexors, and that will pull the back forward, causing pressure in your lower back. So, and then lastly, you also want to try to do some posterior capsule stretch in the sacroiliacs. A lot of people who change positions from sitting to standing, or standing to sitting, or lying to standing have a lot of pain because the sacroiliacs are causing them pain. So I just want to demonstrate a couple stretches that you can do on your own that will be able to give you some relief and address some of the mechanical breakdown that's going on in your body. So first thing I would suggest is lying flat on your back and having your knees at 90 degrees with your hips. When you do that, naturally you should create a little bit of a lordotic curvature in your spine. And if I show you what that would look like, that would basically be something like this curve here coming underneath. So when we lie on our back, we create this curve here. And what I want to do is I want to try to enhance that curve and flatten that curve to start getting a little bit of mobility in this spine. Sort of like a dentist who flosses in between the teeth. We're trying to get some mobility in between the bones in your back. So what I suggest is take a deep breath in. We're going to do 3 repetitions on this. We're going to take a deep breath in. And as we take a deep breath in, that should create a increase in your curve so that I can almost liken a little mouse running underneath my spine. And then I'm going to breathe out, and when I breathe out, that creates this spine to a flattening position, and I also have to contract my lower abs. So this is not necessarily a stretch, this is just more of a movement that you can do to loosen up the lower back. So again, it would be a deep breath in and create that arching of the spine, and then breathe out and tighten your lower abs. Try that 2 more times. Deep breath in, and then flatten out the lower back. And then last one, deep breath in, and then breathing right out. Basically what you're doing is 2 things. You're creating some arching of your spine and flattening of your spine, and also you're tightening up your lower abs. So that's the first stretch I like to do. Then what I do is I go directly into the knees to the chest exercise, which stretches out your glutes, stretches out your lumbar erector spine, and creates a little bit of mobility in the sacrum. By bringing your knees to your chest, you're actually taking some of the pressure off the lower back here. So what I'll basically do is I'll do the same thing, deep breath in, and then arching your spine, pressing the spine flat, and then in this position with the stomachs tight, bringing your knees to your chest. And then we'll do that 2 more times. So deep breath in, creating that arch in your spine, and then breathing out, squeezing the lower abs, and then knees to the chest. Lastly, one more, deep breath in, arching the spine, flattening it. And when I flatten it, it's almost like there's no room between my lower back and the mat, and the knees to the chest. And the last one I usually like to hold for about 20 seconds. One of the big errors I see with my patients is they're not holding their stretches long enough. They show me that they're doing something like this, they do it this way, then they do it this way, then they do it this way. And quite honestly, that's just putting way too much pressure on your spine. All right, next stretch. And just grab a little ball here. You don't necessarily need the ball, but if you do have one, it's great. This is a hip flexor stretch. So basically, we're trying to stretch the psoas muscle that brings your knee upwards. So basically, we're putting our knee alongside of a ball. If you don't have a ball, you don't even need it. And basically, you're leaning forward. A lot of people with back pain will get some discomfort with this motion. I want you to go nice and light. If it hurts, try to back off a little bit. The whole trick is to get a stretch right in through here. And that's stretching your psoas muscle. Have a wall close by so that you can stabilize yourself against the wall. But that's a really good stretch for your psoas. And again, the psoas is a muscle that we have chronically tight, which pulls on our spine in a forward direction, creating rubbing and grinding of the bones. So this will help loosen that. And I'm holding it for about 30 seconds. And then we do the same thing the other way. Again, if we have a ball, we can go right beside the ball with the foot and then lean forward. Back off if it hurts. But go into a stretch where you're feeling the stretch where you can hold for about 30 seconds. You can incorporate some breathing techniques into it to have a little bit more advanced motions. That's another video, not today, and we can show you that next time. You're holding each one for about 30 seconds. Good. All right, so I like to go directly into a transverse stretch, which is for the muscles of the spine, but also the sacrals too. So basically, it's similar to what we just had, but we're going to put our leg backwards. With the leg backwards, we're going to actually turn into the stretch, and you should feel this in two spots. Number one, you should feel this in your psoas muscle, which we just finished stretching. And number two, you should feel this into the QL muscles or the quadratus lumborum muscles that go along either side of the spine. And basically what we're doing is we're turning into the stretch. This is an amazing exercise to stretch your lower back. It also stretches your sacrals too, which I find more often than not is the source of your pain when you have lower back pain. And it's pinpointed. You can feel it like right in that specific area. Same thing the other way. I'm doing these a little briefer because I want to get through this, but you should hold it for about 30 seconds. So you're going straight back, and you're turning into the stretch, almost like you're doing like a corkscrew type motion. And that will stretch my posterior capsule of my sacrum and also my psoas. And I'm just stretching into that like that. And I'm holding for about 30 seconds. Hips are a huge thing that we often neglect, that we don't stretch. A hip stretch, basically what we can do is get our knees away from each other. Try to go down as far as you can. Get the head down and just relax. And again, a stretch is meant to be passive, nice and gentle. If it hurts, you need to back off. But if you feel like you can do a little bit more, then go as far as you can. And basically hold the stretch for about 30 seconds. Again, that's stretching our hip flexors, or also our adductors, the muscles that bring our hips towards the middle. And that's a great stretch. And then lastly, what I like to do is go right into the adductors again. We go sideways, and we can stretch out our hamstring. We can also stretch out our adductor muscles, which are on the inside. And we just try to go as far as we can comfortably. And we're holding that for about 30 seconds. And again, let's say that was 30. And we do the same thing the other way. Stretching that for 30. And that's basically it. I mean, that's pretty simple. It didn't take me but 5 minutes to do it. Just to go over them again, is we go from the breathing exercises with creating the arching in our spine and flattening of our spine. We can press the knees to the chest, which is basically working on the curvature of my spine, trying to get some motion into it. Then we went into, what did we do next? We came back and we did the psoas stretch. We can have a ball alongside and then do it the other way. And then we went right into a stretch to the side. And we did that the other way. And then we went into our stretches for our hamstrings. Either way, same thing. And then lastly, we went into a hip stretch. And that's a great exercise to work on the 3 factors that create pain in our back on a day-to-day basis based on sitting or the activities we do. Is we're stretching the actual spine itself, we're stretching the psoas muscle, the hip flexors, and some of the sacroiliac. That's it for today. Dr. Joel Rosen. Hope you enjoyed it. Thanks.